All right. Hello, everyone. Good afternoon, good morning, and thank you all for joining us for our third Shark Tank sponsored by the Academy of Leadership and Innovation. So just to let you all know, we are recording this webinar and we will post it to the Academy website afterwards. Next slide. Perfect. All right. As you may know, the Academy of Leadership and Innovation is a component of the American Physical Therapy Association. The mission of the Academy is to promote health equity and value in healthcare through best practices in advocacy, leadership, and innovation. I am CJ Morrow, a member of the Tech SIG with Ally and a co-chair of the Frontiers in Rehabilitation, Science, and Technology member engagement group with the APTA, and I will be your guide through our event today. If you are a member of the APTA, we would encourage you to consider joining the Academy of Leadership and Innovation to access the many resources offered, including our various catalyst groups and special interest groups designed to support and represent practitioners like you with shared interests. Not only are there great opportunities to find your people and collaborate, but Ally also offers some great opportunities to continue growing your practice and leadership in your field. Today's special event is hosted by the Technology and PT Special Interest Group, part of Ally. Now, without further ado, let's put our innovation caps on and learn more about the winner of last year's Shark Tank. Here to share with us his experience with the innovation pathway is Ben Cooksey, who is our previous 2025 Shark Tank winner with his innovation, Compress On.
Hi, everybody. This is Ben Cooksey, and my company and I were fortunate enough to win the last iteration of this event. I'm sorry I couldn't be there today. I have class to teach, but I want to say congratulations to everyone that's here, and I think you'll find that the experience is rewarding. The judges are super helpful and give great feedback. Since our event, I got the chance to go to the Future of Technology and Rehab Summit down in Washington, D.C., which gave me the chance to meet all kinds of cool people and get a lot of feedback on our products. And there's been journal articles and podcasts and a lot of exposure type stuff since then. We'll be at CSM in February. And a lot of that, more than anything, this experience has allowed me to kind of start building up more of the Rolodex. You know, I'm a therapist by trade, a professor now, so I know people that know joint mobs and curriculum. So when it comes to product dev or patenting or anything like that, it's a wise man once told me that the solution to all your problems is a person. So getting to meet people and to have somebody that's in these different walks of life and can weigh in if you have a problem or give you advice, is just ultimately one of the more rewarding things about this whole experience. So good luck to all of you. I'm looking forward to seeing what y'all come up with, and hopefully I'll get to meet you at CSM, and good luck going forward. Thanks.
Thank you, Ben. Sorry you can't join us today, but glad that you are spreading the innovative spirit to future PTs out there. We had great submissions to Shark Tank this year and are appreciative of all the innovation out there focusing on improving healthcare and our daily lives as practitioners. For our agenda today, we will highlight our three wonderful innovative finalists. Each of our finalists have provided a short video, which is around 2 to 5 minutes, and then our esteemed judges will have time to ask questions and make comments for 10 minutes afterwards. Now, we wouldn't get anywhere without you and our community too. Sujay Galen will be orchestrating our audience Q&A. If you have a question or comment, please put them into the Q&A chat, which you can find down on the bottom of your Zoom screen. Following the three finalist presentations, Sujay will share the questions and comments you place in the chat to the finalists and judges so all of us can continue to learn. Now let's meet our judges for this year's Shark Tank. I will ask each to come off mute and introduce themselves, tell a little bit about what they do and their passion for innovation. Victoria, let's start with you.
Hi, good afternoon, everybody. My name is Victoria Prosak, and I am a global category manager with Performance Health, which is the leader in distribution for physical therapy products and a we always have a very large presence at APTA and at CSM. And I have actually been fortunate enough to, attend over the last several years. I've been with Performance Health for about 7 years, but I have been in category management and purchasing and buying for, I think, I don't even know, a long time, maybe up to 12 years at this point. My passion for innovation always comes from, I love seeing the new products that can really make an impact, to end users, to clinicians. Like, we work with clinicians and to provide these products. And I'd love to see, new ideas that, create something, a meaningful impact and experience to those end users. So it's exciting for me to join the panel today, and I look forward to learning more about all of your products.
We're so glad that you're here. Our next judge is Paul. I'd like you to introduce yourself.
Yeah, hi everyone. I'm Paul Sabin. My background is in mechanical engineering. I had a product design consulting company for about 20 years where we developed biomedical products and consumer products and robotics products with our clients. And now I work at Harvard. I run the Move Lab. The Move Lab works in wearable robotics for assistive and rehab technology. And we're a team of engineers that help take things that are coming out of research and try to spin them out of the university and get them into startups or get them licensed. So that's really where my passion is like Victoria said, it's in the impact. And it's really fun to work on new things and see them get into the real world and help people out. I'm excited to be here.
Excellent. We're excited to have you, Paul. And our last judge, but certainly not least, is Cheryl.
Hi, everybody. Excited to be here as a judge today. I'm the co-founder and CEO of Blue Marble Health, which is a remote therapeutic monitoring platform for chronic disease and aging. I've spent about 2 decades of my life advancing innovation in physical therapy, from co-founding Technopalooza, which I hope you all come to at CSM this year, to developing digital health platforms that improve patient care at scale. Innovation in physical therapy isn't really what I do. It's truly my life's passion. I've dedicated my career to working in innovation in physical therapy, but specifically what I really am interested in is clinically validated care that improves patients' lives, empowers clinicians with efficient tools, and builds sustainable healthcare models. And the way I got started, believe it or not, was working in academia, and we were building great tools and being innovative and putting things on the shelf at the end of every semester. And it was breaking my heart because we'd take them out to the clinics, and clinicians and patients loved what we were building, but they never went anywhere. And one day I saw the cover of, I think it was like National Geographic, with a tribal person with a cell phone in his ear. And I thought, I bet we could get physical therapy out to everyone if we could get it out through the cell phone. And that was sort of the impetus of my turning my career into leaving academia and saying, we got to go for it. And that's where my innovation in physical therapy got started. So I'm super excited to be here today.
I love it. And innovation can come from anywhere and everywhere. So, and again, like Ben said, knowing someone and reaching out and talking to people is one of the best ways to start to get creative in how we can improve our practice. Well, I know everyone is waiting with bated breath, so let's get started. Our first finalist is Gravitrex.
Hi, I'm Kira Burns, co-founder and CEO of Gravitrex. So my dad was in a serious accident where a car crashed into the restaurant he was eating in. And when we watched him go through the painstaking process of recovering his ability to walk, we realized that every step counts and the current equipment really falls short. And this is the same challenge faced by patients after stroke, surgery, or serious injury. Walkers aren't safe or supportive enough, and advanced body weight support systems are time-consuming to set up and uncomfortable for patients, and they're really limited in access. Every PT I know says the same thing, that patients just don't get enough steps. At Gravitrex, we're building tools to make it easier for them to get those reps safely and more often. We started prototyping literally in our garage and then assembled an expert team of engineers and clinicians. Together, we developed our lead product, an easy-to-use mobile gait trainer that delivers constant unloading over ground with a small footprint and no power required. Our patented mechanical system provides consistent unloading, no motors, no electronics, and no build-out required. It's built for use across post-acute care settings. We listen to clinicians and design Gravitrex around real-world workflow. It's a fast, comfortable way to get patients unweighted and fall safe, so you can turn hallways into extra clinic space and reduce staff strain. Our beta in-clinic model is now being demonstrated with partners. Next, we'll develop a home-based version, bringing safe walking recovery on the clinic. As post-acute care faces higher demand with fewer hands, Gravitrex is making it easier for therapists to support recovery, helping more people get back to walking again.
Thank you, Kira. So as we can see, innovation comes from many places, and I've so often heard the creative spark happening from seeing family members and friends go through something and then trying to find a better way to help them recover. Amazing, innovative thinking. So now I'm going to open it up to Q&A with our judges and Kira.
Hi, Kira. This is Cheryl. I'll go ahead and jump into the first question. I would love to know more about some of the work you've done to test the product, and I don't know if you validated it with any particular populations, or what sort of outcomes are you seeing?
Yeah, so clinical evidence-based products we're really committed to creating evidence-based solutions. So our first clinical study was done with a professor in the Phoenix area of physical therapy, where we tested a prototype for the efficacy, does it unweight, and examined the gait mechanics. And we're really excited that a subset of that early data was just released in a poster presentation that we showed at ACRM last month. And we're really excited. We're getting great feedback on that. And those results will be incorporated into future versions. Additionally, we incorporated clinicians and the clinical viewpoint at every step of the process. We gained early user insights before actually beginning our beta development work. And then during beta development, we embedded 5 clinicians from various post-acute care settings, so inpatient rehab, skilled nursing, outpatient neuro PT, in the beta design process, and they were able to give their viewpoints along the way. We will next. We'll be starting a phase of clinical validation in which we will look at subjects with specific disease conditions. The first study, I should have said, was in 10 healthy subjects. Additionally, the user perspective is also the end user perspective, and the caregiver perspective is also very important to us. So that perspective has also been part of our user insights work, and it's part of the journey that we continue to have every day. So, I mean, I just spoke yesterday with a woman who is taking care of her mother post-stroke, and both she and her mother are excited to get involved and provide us feedback as part of our journey.
I have kind of a follow-up to what you were just talking about. I see you've built, along the way, and it sounds like you're testing them. Usually in that journey, you learn some things that are surprising to you. Like, are there features in your products and things that you've learned from actually building and testing with users that are incorporated in?
Yes, there are many things that are incorporated in that we've learned along the way. And I will say that one of, what Cheryl said in the very beginning really resonated with me in terms of building things and maybe then seeing them, not go somewhere, be on the shelf. We've seen so much effective technology that doesn't get used and sits in a closet and becomes a towel hanger if it doesn't integrate into the clinical workflow. So that is extremely important to us, and it's why we're obsessed. So you asked the question about, are there things that surprised us that we then incorporated? Yes. From everything to the form factor. When we were doing early, you could, see our early prototype. It's just an 80-20 box, right? But we understood that visibility and the ability to actually to have visibility to the legs and manipulate the legs was really important. And that really drove our form factor as we were designing our beta prototype. And I have to say that having the use of AI to create really good professional images was extremely helpful in that journey as well, because as we talked with physical therapists and we understood their needs, we could then create a really professional rendering that we could show them and say, is that what you're thinking? And get even better insights from them about what their needs were, and then incorporate that into the design.
I have a question. What safety mechanism is in place if the patient does, in fact, fall?
Yep. Great question. So that was part of when we did our hazard and risk analysis, and we identified and we looked at all the potential areas. While it's extremely unlikely that so if the patient does fall right now, they are attached by 2 cables, and those cables will catch them. There is an additional, in order to mitigate any remaining small risk, there's an additional strap that's used from that is separate from those cables, which will catch the patient if they fall.
Is the width sufficient for larger patients, and can it still pass through a standard doorway if so?
So great question. We are designing this to be usable for a range of patients, and particularly we want to make sure that it accommodates a range of patients. This today is our beta prototype version, of which we have one, and this one version has a limited size range. But we are using this to validate in some real world user settings, and after that, we will create versions which accommodate a wider range of patients.
I have one
but
more.
It does fit through a standard door frame, yes, and that is one of the user requirements. And I mean, I mentioned in the video that we are in the future we'll be creating a home use version, which will be smaller for the home use setting, and that will have different design requirements based on the home use setting.
Thank you. I do have one more question I'd just like to ask really quick before passing it on to somebody else. What does the setup process look like? Because I couldn't tell if it was able to be taken apart, or at least like the sides to come down from a storage perspective, but can it be stored? Can it be folded up? What does that look like when it's not in use?
Yeah, so we know that storage and use is really important to our users, and it's part of the learnings that we're getting as we're going into this testing with physical therapists. We get really operational and detailed and understand what they need, where they will put it. This current beta prototype version, it does not fold. It's one unit. It can be rolled and put away easily, but it does not fold. We are getting user feedback as part of this process to understand what the storage functionality will need to be when we develop our final product.
I'd like to hear a little bit more about the unweighting. Like, is there a spring involved? Is it like a static unweighting? Because it looks pretty cool, but all I saw was a little cable piece.
Yes, the IP that we have multiple issued patents for this technology. It is a fully mechanical system. There is a spring involved, and it's the unique thing is that it's able to deliver a constant lifting force on the cables, which allows us to create this type of unweighting system, which does not require power, does not require a battery, and we can make devices that are cost effective with a smaller footprint.
Well, and you just answered my next question, which is, do you have any of this intellectual property protected? And it sounds like you do. Excellent.
Yes, we do, both in the US and globally in strategic markets.
Awesome.
And you said one of your next steps is to do a home product. Like, what do you think that some of the changes will be between the home product and the clinic product?
Well, we would develop a user needs and a product requirements document that reflect the home setting. So what we some of the things that we would expect would be more would be doorways, spaces, more uneven surfaces, and the ability to need to fold it, to make it small so that it's not in the way, the ability to need to lift it. Those are some of our expectations, but we would go to users to understand what their needs are and go through the process of hearing those needs from the users.
And how would you say, Kira, that you differentiate yourself from competitors?
Well, we are designing devices that we intend to be scalable across post-acute care, and that should be an easy, fast way to get people unweighted and fall safe so they can really get more reps, get the steps that they need to recovery. We're trying to fill a technology void between some of the larger advanced body weight support equipment that can be complex to set up, time consuming to set up. Some people tell us 20 minutes to get people set up, and can be uncomfortable for patients and sometimes too complex for many settings. And at the other end of the spectrum, we have devices like walkers or platform walkers or parallel bars where the physical therapists tell us that often, patients are not safe and supported enough in those settings. So we're responding to that technology void that we're hearing from physical therapists and coming with a device where it is where we're providing unweighting with a completely new technology.
CJ, how much more time do we have?
I was just to give a 2-minute warning. So we're going to open up our judge Q&A session from 10 minutes to 13 minutes. And I will, I'll give you a 2-minute warning before that 13 minutes is up. So if you have a couple more questions.
Okay, I'll ask one more, Kira, and then I'll probably just shut up because I tend to be a big mouth. I'm just thinking about, gait in general. So my PT hat on and arm swing and things like that. And I'm, kind of thinking about your design and wondering, and I totally appreciate the need for getting more steps. I loved when you said that, PTs just say like their patients don't get enough steps. But at what point do we, maybe practice both or transition away from your device into something where we're facilitating a more natural gait pattern?
So we fully intend for our device to be part of a recovery journey. What useful for a clinician at the point where it is difficult to get a patient to enable gait, and we know that clinicians will do a lot with just to get a patient up and moving, and to be useful at that part of their journey. And the aim is that we then can that a person can graduate afterwards from this device to walking on their own or walking with a cane or with a walker. But we see this as an important tool in a physical therapist toolbox where they can really address that technology void that exists today for the right user.
We have about 20 seconds left, I think, for a lightning question.
Or even while you're thinking, can I just say thank you? Thank you to the APTA and thank you to the Academy of Leadership and Innovation for the opportunity to talk about what we're doing. We're really thank you for your questions and your feedback. It's really great to hear from experts like you what you're interested in and curious to know.
Excellent. Man, you brought it right to 13 minutes. At that time, it absolutely
without even trying.
It was beautiful. I want to also express to our audience that our Q&A is open, and the Q&A doesn't just have to be around the products that you're seeing today, but also around innovation and creation and finding a problem and working to solve that problem in general as well. So we heard from Kira, innovation comes from an idea, and then that idea develops a problem, and then we have a solution to that problem, and how there's so many people that can help to build that solution, mentioning PTs, going back to mechanical engineers, building it, iterations. We start with that one first minimal viable product, and then thinking about how do we make it better. A lot of that discussion. She mentioned IP, patents, product requirement documents. All of this is stuff that please put into the QA if you want to Q&A if you want to learn more about that, because we're here to actually help you develop solutions to your ideas too. With that, let's move to our second finalist. And it was a great Q&A session. So let's move on. Our next finalist is Ringgold ExoGlide.
Imagine yourself walking, minding your own business, and bam, out of nowhere, you tweak or mildly sprain your ankle. But like everyone else, you don't have time for this. But instead of wasting a moment or a day laid up, you have an ExoGlide that will get you back on track, almost like nothing had ever happened. Hello, I'm Dr. Justin Ringgold, a licensed physical therapist and inventor of ExoGlide, the first of its kind external ankle trainer designed to transform lower extremity rehabilitation. Every year, 2 to 3 million Americans experience ankle sprains, according to the CDC, and my mission is to accelerate recovery, enhance proprioception, and prevent chronic ankle instability. It affects up to 40% of cases who have had a previous sprain and can trigger a cascade of kinetic chain issues from knee strain, hip compensation, to long-term osteoarthritis. ExoGlide stands apart by combining advanced arthrokinematics and osteokinematics to deliver precise joint mobilizations, an anterior glide to the distal tibiofibular joint, posterior glide to the talar crural mortise, and a gentle distraction force with pure dorsiflexion. This results in sustained mobilization at the ankle's pivotal talar crural joint, immediately improving mobility, reducing pain, and restoring neuromuscular control. Clinical pilots and patient testimonials show impressive results, not only for acute ankle sprains, but also for plantar fasciitis, peroneal tendonitis, ataxic gait, anterior knee pain, Achilles tendinopathy, post-surgical recovery, neuropatient recovery, and fall prevention for seniors. Here are a few of many of my patients' reported benefits. 35 years of bilateral ankle, knee, hip, and back pain went away, and I can walk farther without pain. 2 weeks after an ankle sprain, I was still limping and had pain. ExoGlide reduced my pain, and I stopped limping and could do normal exercises again. I normally walk on the outsides of my feet, even have wear marks on the bottom of my shoes to prove it. But after wearing ExoGlide, I was walking flat on my feet, and my hip pain nearly went away after 30 minutes of wearing them. This lightweight 3D printed device integrates seamlessly into any PT protocol, driving patient compliance and reducing recovery times by at least 25%. It's an essential addition to every physical therapist toolkit, delivering evidence-based, engaging rehab that truly delivers outcomes. Putting on ExoGlide is simple and can be done very quickly and efficiently. You just hook it into the eyelets at the base of the shoe, put it there, wrap it around the distal shin, and you just tighten that up, and you can tighten this to comfort. Okay, taking it off is just as easy or easier than putting it on. Just flip it forward and latch those two carabiners, and that's off. You can walk, go for a stroll. You can even run in ExoGlides. There's really no limit to what you can do with them. Even going into a lunge, ExoGlide will not limit you because it will simply move out of the way. I'm excited to introduce a new design that's about to launch. A fully 3D printed device engineered to absorb impacts and instantly return to its original shape, making it an ideal solution for athletes seeking durability and performance. Thank you, APTA Academy of Leadership and Innovation, for the opportunity. I am eager to collaborate with leading researchers to rigorously validate Exoglide's impact, not just as a top-tier recovery aid, but as a safe, proactive solution for athletes and anyone seeking to improve mobility. Together, we can reduce injury rates, ease healthcare burdens, and elevate the standards of physical therapy. Let's glide towards a stronger, more resilient future.
Thank you, Justin. So it's amazing to see, we start our first finalist with patient inspired, and now we have an innovation inspired with how can we, and as a physical therapist, thinking about how can I extend and sustain the effect that I have from my hands in the clinic to beyond. So it's amazing to see how a PT's knowledge of biomechanics, the effects of hands-on mobility treatment can be translated into innovative options that persist outside the clinic. So let's open it up for our judges.
I was just going to ask just a first question being, is this, are you planning on going through the FDA medical device registration process for this?
Yes, I have all the paperwork set up and ready to submit to them. Just whenever I get the capital, pretty much pursue it.
Okay. That's just something from like a distributor, from a perspective of like the terminology and the marketing that you're using for the product, to just wanting to ensure, because I think a lot of times when we're reviewing new products, like there are always questions around, well, is it a medical device? Is it not? Should it be? Should it not? So it sounds like that's all squared away and you're moving towards that direction. So that's great. I was also wondering, while it's treating the pain short term, what are the long-term benefits or gain from use of the products?
So long-term gains I have seen is increased muscle activation. He was also like an ankle specialist who tried it on, who'd had a severe ankle injury whenever he was in high school. And he tried everything. And after wearing it just normally for 8 hours a day, he noticed he was actually getting activation of his posterior tib again, and his pain was decreasing and could do more in the gym.
So so I guess that is a question, like what's the intended use? Like how long should they be using it? It sounds to me like they'd have to pretty much continue to use it as part of their day to day if that pain comes back or persists. Is that the approach that you're taking with the product?
Yeah, it depends kind of on the chronicity of the issue. So if they've had a more chronic issue, then they would need more long-term wear. I've seen carryover after somebody wore it for just 30 minutes and could persist for a couple days, maybe make it till their next session and wear it again.
And the intended use is for like in clinic and for at-home use or end user use, or just for at-home use? Like, as you know, CJ, I know you were kind of mentioning that as well. So just curious if you can clarify.
Yeah, for both, and in many different settings as well. So it's vital, especially if somebody's had a stroke and they've had issues with walking. It's imperative to try and get that motor pattern back as quick as we can. So many different settings, outside the clinic, inside the clinic. It's very versatile. And it's really surprised me, all the benefits that it has had.
And I guess that I have a follow on to that, which is, you describe lots of different places where this can be helpful. And sometimes that is, a blessing and a curse, because it's a challenge sometimes to market it. If it's good for everything, or it's really good for this one thing, those are different challenges. Maybe you could talk about like what you think that the one or two most useful conditions are that it would be used for, and why they're the most useful ones, how it benefits them more than some of the other things that you listed.
Certainly. So definitely, like if you've had a subacute ankle sprain, ATFL recovery, which is one of the most commonly sprained ligaments in the foot. I've seen amazing results with ataxia. People who come in and they just can't really find their feet, and then we put these on, and it's just an instant result that they improve with balance, and they're able to have a more normal gait pattern.
And maybe you could say a little bit about why that is. Like, how does it work? Like, to the extent that you can for those conditions.
Yeah, sure.
What's the mechanism of action?
Yeah, so the mechanism of action is getting the joint where it's gliding properly. And so when you get the joint gliding properly, then the muscles are like, oh, yeah, this is how we're supposed to move. So that's where you get some of that instant result, because you stabilize in moving that joint properly, and then everything just gets on board.
Are there plans to do any type of clinical research or clinical trials to validate this information?
I don't have any current plans right now, but it is ready and available for anyone who wants to test it.
And along those lines, thanks, Paul and Victoria. You guys stole all my questions this time. I am, full disclosure, no ortho PT at all, but I'm curious as to how it actually works. Like, I feel like it makes sense to me, the dorsiflexion piece. It looks like there's some cables in there. Is there like a machine in there? How is it moving the bones?
So the main mechanism is where you have the fulcrum on the top of the foot with the bands pushing down and then pulling this way. So you get this action at the ankle. That's the primary mechanism, and then the rest allowing the muscles to take over.
So there's no actual like mechanics inside of it, like that new prototype that you showed, the spongy looking
right?
one. No.
Yeah.
Interesting. How do the bands push down? How does that?
So where it bends over the fulcrum, that pressure down is enough to push down and back.
Oh, okay, I see.
Is it bands that have resistance built into it? And if so, are there different resistances based off of somebody's, dependent on their foot, or like how it needs to essentially, right, from a gait perspective, I guess, like it seems like it would have to be a little customizable.
So yeah, you can customize the tension. It's the same band, but you can tension it more based off of patient feel and feedback. Not too much, because you don't want too much pressure on the top of the foot, causing a little bit of discomfort. But most people forget they're even wearing it after 10 minutes of wearing it.
And I'd love to hear a little bit more about your business model. How are you intending to sell it?
So right now I am selling it through my website, and I plan on going, kind of setting up a booth and teaching physical therapists about it. And it definitely will start in the clinic more than likely, and then spread outwards from there. And it just definitely be a great thing for athletes who are trying to recover quickly.
And does it have a reimbursement code associated with it?
I haven't tried to reimburse it through insurances yet, so it's just all cash based.
Okay. And I think early on there was a question, and I don't remember now if it was about your intellectual property or if it was about FDA, but which one did you respond to, and can then you respond to the opposite one?
So sure. So I have a notice of allowance from the patent office to go ahead with it. So and
do you think it will require any FDA approval, or have you looked on their website as to where you might fall?
Yeah, I should fall into a class 1 category, which shouldn't require. However, I know for validating it and stuff like that, it would help to have it classified by the FDA.
Yeah. And then the one question I forgot to ask Kara, I hope she can come back later for a Q&A piece, but are you fundraising, or have you tried to go after any grants, like NIH grants and stuff like that or do you not need it?
I could certainly use more funding for research and things like that, and getting to pure production. The quote I was given from who I'm working with right now for 3D printing on this new one is about $15 to $20 per device, and so just working on trying to get that down.
Yeah, could you talk a little bit about where you are in terms of scale up? Like, how many of these devices have you made? Do you plan to always 3D print them in the future? How much do you think you're going to sell them for? Some of those things would be great.
Well, I'm open to figuring out more ways to maybe produce it in more in mass. Because right now, to get 10,000 of them will take like 5 months, from what they told me. But they will do like a slow rollout, so I'll have some that'll be making and putting together and stuff like that to be able to send out. Right now, they're selling on my website for around $150 a piece. So,
What bands are you using currently, if you don't mind me asking?
so they are a bungee cord material that I use.
Okay. And I apologize if you answered this question already. Is there an application for neurological conditions, and does it support dorsiflexion?
So it assists with dorsiflexion. They do need some amount of tibialis anterior activation before I would recommend it for somebody. But just getting that joint gliding properly helps to recoordinate those muscles, so that they can. Main thing I've seen is somebody with post-stroke, somebody who could barely even move it, put it on there, and then they started getting more activation and they could actually use it within a couple days of wearing it. And so, yeah.
And what's your market size, do you think? You're looking at ankle.
Yeah, so the initial market size is around 2.2 billion for just in the orthotics phase. So I think it'll definitely expand beyond that, especially when we can validate prevention and things like that.
So I had a question. I was just a little unclear on what you said about the patent. There's something. Have you applied for a patent? Have you got an issued patent, or are you just clear to produce it, clear of other patent?
So yeah, I'm in the final phase of having the utility patent, and I got a notice of allowance from the patent office to go ahead with it. That just
see. Thanks.
Mm-hmm.
I don't know if there's any questions from the Q&A, but I'll ask one last one. And that is there like a protocol that goes with this? In other words, are they supposed to wear it during all waking hours or 20 minutes a day, or, how does that work?
So typically I have them wear it like during the session. So that could be anywhere from 30 minutes, 45 minutes. And then for those with more chronic issues, then they would want to wear it longer to get that. And they can wear it 6-8 hours a day, just as long as they're up and moving. If they stop moving, then I recommend them taking it off. Because after about, I wore it, and after 6 hours in the car, I had to take it off because it does put that pressure on the top of the foot, and eventually that becomes uncomfortable. But if you're up and moving around, you don't feel it, like you even forget you're wearing it.
And you showed that new product that looked pretty cool. Can you talk a little bit about the motivation of that? Like, why did you develop that, and who's going to use it? What's the benefit?
Yeah, so the original one that I had has a kind of a hard shell on top, maintaining that fulcrum, and so the new one, I wanted to be able to maintain that fulcrum, but also be able to take an impact for somebody who's an athlete playing sports, so that it wouldn't harm somebody else who was running into it. Not too worried about the patient. I was worried about somebody else. And now it absorbs the impacts, and yeah, no problems.
One last question. Can it be adapted for shoes with Velcro or slide-on styles?
So it can be, the shoe can be adapted, or I'm coming up with one that can work with people who don't have eyelets or anything to put on. It'll just kind of hug the end of the shoe, and then you can hook into it, so it'll be more universal.
Excellent. So we are at our 13 minutes, and I know we're probably even more curious. So some of the things that, we hear about innovation and in creating our ideas is, we heard about 3D printing, and so many people, I think that when they have an idea, it has to be some grandiose manufacturing system that has to be put in place, but a lot of innovation happens in the so-called garage or in your office or in your clinic. So it really is more of an experience that something that you can do easier than kind of what it's put up to be. We talked about FDA medical device, class 1, 2, and there's 2 and 3, as well as intended use, marketing. Talked more about IP, which is probably the intellectual property. The process of getting a patent, I think is one of the most, one of the painful part of it. However, protecting that IP and that your idea is so important as well. So please continue putting in your Q&A into the Q&A box, and we will move on to our final finalist. You can't say that 5 times fast, right? Provider Pulse.
Hi, I'm John Shipley, Doctor of Physical Therapy and co-founder of Quara. Thank you to the Academy of Leadership and Innovation, and thank you to the APTA for the opportunity to present today. I want to introduce our solution, Provider Pulse, an early detection system to reduce burnout in physical therapy. I'd like to start our talk by sharing something personal. 3 months into working as a new physical therapist, I remember sitting on the couch when I had this thought that changed my life. The thought was, wow, I am drained. I can't keep doing this much longer. Becoming a PT was something I dreamed of for so long. Now I was grappling with the decision to leave the profession within the first year. Our company has talked with dozens of therapists, and we know that burnout is becoming an epidemic in our profession. Apart from the emotional toll of burnout has a large financial cost on clinics across the country. For example, based on publicly available data, a large outpatient network of 3,000 clinicians would lose over $58 million per year based on its reported turnover numbers. On a more clinic-specific scale, when you factor in the cost of ramping down a clinician who is leaving, the lost revenue of having a vacant staff position, the recruiting cost to find a new clinician, and the cost of ramping up a new hire to become productive, there are tremendous financial costs to a clinic if they lose only one physical therapist. So now, fast forward 7 years from the existential crisis of me sitting on the couch to another critical reflection moment in my life. This time, the thought racing through my mind was, what if we could predict and prevent burnout before it happens? That's why we created Provider Pulse. We've developed an AI-driven platform that uses machine learning to provide physical therapy managers with early detection of turnover within their teams. Here's how it works. We use APIs to pull data from a variety of sources in the healthcare system to identify and predict burnout among clinicians. And the best part is, it requires no extra clinical work. There are no extra surveys for clinicians and no manual data entry by the managers. Our machine learning algorithm integrates background data that is already entered into the healthcare system to identify signals of burnout within your teams. Our platform provides powerful objective data to managers so they can take better care of their teams. We can also highlight the financial implications of turnover to help support managers' conversations with leadership. Our software can track trends over time to help managers track how their interventions are changing burnout risk. And we also provide customized profiles of each clinician so managers can provide personalized coaching that is tailored to each therapist's unique needs. So that's what our platform looks like and what it can do. Let's look at the efficacy of our interventions for physical therapists and physical therapy managers. With the early detection of burnout, we help managers use data to take proactive steps to reduce the risk of turnover among their teams. For example, for that same large outpatient system that is losing over $58 million per year, if we can reduce their turnover by 20%, we can save them over $11 million each year. And when we have less turnover, a clinic's team chemistry flourishes and leads to improved patient outcomes. Our entry into the market will begin in outpatient physical therapy. That is where a large portion of physical therapy is delivered and where the highest rates of turnover exist. Fortune Business Insights projects a 10% compound annual growth rate for our market over the next 10 years. So we're confident that we are entering a growing market with lots of opportunity. We estimate the size of the market at $800 million based on the number of outpatient practices and our annual cost for use. And we have scoped down the serviceable, addressable, and obtainable markets as well. Here are some of our close competitors that healthcare clinics currently use to measure burnout. We differentiate ourselves in that our platform requires no additional clinical input and provides a look at burnout risk on a multidimensional scale. Our team has a strong foundation as we have completed a cohort of the NSF Regional I-Corps program, We are currently receiving mentorship through the Johns Hopkins Venture Mentor Program. And we would love the opportunity to have a feature at the Academy of Leadership and Innovation Business Meeting at CSM in 2026. This will be a tremendous opportunity for us to connect and expand our product to our target audience. I am so proud to be a part of this team with my co-founder, Elise, as we are both passionate about helping physical therapists and managers work to reduce burnout across the profession. Thank you again to the Academy of Leadership and Innovation and to the APTA for the opportunity to present today. We are Quare, and we have developed Provider Pulse to help sustain the heart of caring and physical therapists. Thank you.
Thank you, John. So we've seen another amazing innovation that comes from not just helping our patients, but helping each other as fellow practitioners. So let's pass it on to the judges for our final finalist Q&A session.
I was wondering if you can elaborate on what those protocols are. So like walk us through, we have a high risk clinician. What now? Like how do you actually work with them and help intervene? And what does that mentorship look like if you've identified them?
Yeah, Victoria, great question. The great thing about our software is that it can give customized recommendation based on the clinician profile. So there's a little bit of onboarding that would come with the software, but the manager would get sort of customized recommendations specific to that clinician to see based on how they best receive feedback, what's the appropriate sort of coaching style for that person, and to sort of address their highest needs, whether it's they're struggling with documentation, sort of managing their schedule outside of work, sort of having a tailored coaching to go along with the signal that they're burned out, but have it customized for each clinician.
And what is the typical turnaround time for these high-risk clinicians to move into a lesser risk profile?
Yes, we're still in the alpha phase of testing our product, but we probably anticipate sort of retesting every few months to see. Hopefully you can have a quick intervention, but sometimes these are larger issues that take time to unpack and time to change. So on the order of a few months, we'd hope to see some quick change.
And have you seen an ROI yet in terms of even if you're in the testing phase where we've seen these prompts, these changes really impacting those clinicians where they're not necessarily leaving the practice? Like, have you seen any of that come full circle yet, even in a testing phase?
No, not yet. We don't have any financial data to share, but we're confident based on our costs and the value of retaining clinicians that we can deliver a high ROI.
And how do you know that you're identifying the people that are at risk of burnout? I know you can make an AI that will identify people, but how do you know that it's identifying the right people?
Sorry, maybe just to clarify, you mean like it's a true positive, not like a false signal? Is that what you're asking?
Yeah, that it's not a false signal, right? It says these 3 clinicians are in danger of burnout and these 3 are not. How do you know that it's that's correct, that those 3 were really in danger of burnout and the other 3 were not?
Yeah, so building a machine learning algorithm takes months and months of training. So initially the model might not start out very accurate, and our users know that. And so there's initial training period, but essentially we train it and then feed it test data to test the accuracy of it. And we can refine and fine tune the model as we go. And we hope to deliver a high degree of accuracy. So we know that there is going to be some uncertainty early on when we're training the model, and we don't anticipate, and we've sort of talked to our users about that. But once it's sort of up and ready and achieving a sufficient accuracy, we'll have good confidence that it's selecting the right providers.
And so I guess a follow-up on that, are you training it? Will it be specific to each institution? Will it be learning for that institution, or is it a generalized model? And I guess in addition to that, is there historical data that you can use so you can get a lot of data to train the model before you've implemented it? Can you talk a little bit about where you are?
Yeah, great question. They'll all be customized models. We know that's sort of a bigger technical lift, but we think that a lot of practices have unique inputs, whether it's the different types of EMRs they use or the different HR softwares or how they're integrating tracking their clinicians in other ways. So we are going to build custom models for each clinic. And sorry, what was the second part of your question?
Historical data.
Oh, yes. So our first users have over 10 years of historical data that they will sit and sort of label it as this person turned over and this didn't. So we have a mountain of data that can start training for our first users.
Do they label it just for turnover or turnover because they were burned out? Sometimes people just leave because they move or whatever.
Yeah, and that's the benefit of having a great relationship with our first customers is that they're labeled it exactly how we're trying to predict if these people left because they were burned out.
Mm-hmm. Nice.
And is this sort of like a passive surveillance system where, and obviously you're not going to tell us what ingredients go into your machine learning model, but things like this person hasn't taken a vacation in a while, or this person is writing their notes till 8 o'clock at night, and so they don't have work-life balance, or this person has taken every Monday off for the last 3 weeks, or they need a long weekend redundantly. So is it just sort of keeping like this passive surveillance, and then a signal will pop up, and then the manager can kind of make a prompt to say, hey, it's been 3 months since you've taken a day off. Why don't you think about taking a vacation? I'm worried about you burning out, or something like that. Is that kind of the idea?
Yeah, you got it exactly. Sort of ambient background data that's already there to sort of detect signals when people may be at risk. And everybody's different. That's one of the things we've learned in some of our initial testing is it's not a one size fits all, but the beauty of our machine learning is you can tailor it to each clinician.
Mm-hmm. And you mentioned about capturing input from a bunch of things, even from like note writing. So is it actually like reading the notes, or like considering the time it's taking, or things like that, which may or may not be signals for burnout, but when aggregated together with other signals, maybe just kind of increases the likelihood?
Yeah, great question. We won't actually be sort of looking at patient data or notes, but just more of the metadata. How long does it take to write a note? How many patients are you seeing? How long does it take to finish all of your notes? How many late notes do you have? In addition to other metrics of emails and, like you mentioned, PTO, call outs, those types of metrics.
Interesting. And I guess based on your response to Paul's question about each system will have a bespoke model, what are you anticipating the learning and then testing period to take for each, like onboarding each new customer?
Yeah, initially, part of it is our resources and bandwidth. It'll probably take 3 to 6 months to train and really validate, just because of number of people we have working on this. But with the larger team, from a development side and technical side, I think we could get that a little bit quicker. But right now, yeah, it's on the order of 3 to 6 months from training.
And then you also mentioned about, you said something about how it would remind the managers about, the way this particular person appreciates feedback and receives feedback and things like that. So is there also embedded surveys or other kind of personality profiling that you would then integrate into the model?
Yep, exactly. We haven't quite built that out, but we know that in order to give tailored, customized coaching, we'd have to know the clinician a little bit more. So it would be a short survey, like you suggested, some type of personality or learning style survey, coaching style.
Gotcha. Well, I'm sorry to hear that you felt burnt out after only being a PT for 3 months. That's a little scary, but I'm glad you're working to fix the problem. So
thank you. I'm doing much better now.
Awesome.
That's great. I have a question about the pricing side. I could imagine, like, do you have an upfront fee? Do you have a monthly subscription? Do you, if it was really working, you could share like the ROI with them. Like, how are you thinking about that pricing side?
Yeah, exactly. Kind of all of the above. Yeah, upfront starting fee, monthly subscription with base, premium, and enterprise models for cost based on the size of the practice. And then, yes, it makes the ROI very clear based on costs. You save this, reduce your turnover to this percentage, the order of X ROI. So that's sort of our formula.
Have you thought about it? I mean, I imagine like if you really are getting a high ROI, you could just say, hey, it's free to install, and then we're going to take half of the ROI with you over time. And then people have a very low barrier to buy your product and get going. That's upside.
That's a great strategy. And thank you for that. We can definitely take that to our rest of our team and consider that. Yeah.
Interesting.
I'm curious about the feedback from the clinicians. How do they feel about being monitored?
We have heard that, and people, that as a hypothetical, we have heard that as feedback. I think that I'm still practicing, and I know that my managers know how long it takes. There's metrics on my documentation. There's metrics on my time off. So I think everybody is aware that they're monitored in some respect, and we get pinged about finishing our notes and finish your billing and this kind of things. So I think this is just an added layer of sort of pulling data from the variety of systems that the clinician touches that's already going on, and in hopes to help the clinician. So if there is any concerns, that the idea is that this is designed to keep you in your position and create an environment that's supportive for the clinician.
And similar to the question that I asked the previous group, in case there's any angel investors on this call, are you fundraising? And if so, what are you looking for? Have you gone after any NIH grant funding?
Yeah, thank you, Cheryl. We applied to an SBIR grant earlier in the year. This year has been a pretty difficult year for federal funding, as we didn't get accepted into the SBIR sort of phase 2. There's the pitch, and then the proposal. So we didn't get to advance there, and we applied for a couple local grants here, which we got good feedback at, but haven't sort of achieved any funding as of yet. We're pursuing non-dilutive sources, so we're being pretty intentional about where we're pulling funds from. So right now we're bootstrapped, but are very open to non-dilutive funding sources.
And then real quick, last question, Paul, sorry, I just saw you on mute. Have you thought about other markets besides physical therapy?
Yep, and that's the part of the branding. Our company is Quare, and we have different product lines. So yes, we do see opportunities in a variety of healthcare positions, primary care, nursing, pharmacy, even has high rates of turnover. So trying to master this one market and expand when we're ready.
Awesome.
That was exactly what I was going to ask, but a somewhat related question is, can you talk about any competition that you have in this burnout space?
Yeah, other than the survey sort of that we mentioned that are out there, we know that there's limitations to surveys. The other people that are doing sort of machine learning, monitoring, and predictive forecasting are in different spaces. So that's the feedback we've gotten from some of our grant proposals and things, is that people are doing this in other spaces, and they can pivot into the healthcare space. So we're hoping to have the first mover advantage and the benefit of having the relationships that we do in the healthcare space to sort of build out and sort of get ahead of our competition.
In building out I see we're getting a 2-minute notice. In building out your algorithms, is it evidence-based? I mean, is there a lot of support? I'm not, into this burnout domain at all, so I have no idea the science behind it, but is there a way to inform your algorithms?
Yeah, we've have unpublished data suggesting that documentation is one of the biggest burdens for folks, but also the administrative burden. So lack of support staff, increased time with paperwork outside of work. And yes, we talked about PTO already. So we have unpublished data about that. But as you onboard our new users, we plan to implement split testing, where we'll compare sort of the effect of using the program and using the machine learning algorithm to clinics that are comparable, sort of matched clinics and not using the program. So sort of a basic cohort comparison and looking at the return on turnover.
What have you learned from talking to managers about your product? What are some of the most common responses that you're hearing?
Thankfully, a lot of them think it's valuable, which is good. A lot of them ask for the financial piece to be built in there to show the return and to show for their leadership, because that's sort of what talks for people in the executive space. And then a lot of them asked for the coaching and the specific "what do I do" answer, because it's great. You have 3 clinicians in across 5 clinics that are burning out. But then what do you do? So we're still building that out, but that's been great. Very helpful to hear that feedback as we've been demoing the prototype and talking to our initial customers.
Will you be tracking it? Oh, sorry, just one quick question. Will you be tracking it by manager? Like, is there a chance that you'll see certain managers are causing burnout and they get under pressure? Like, does that issue come up?
Yes, so it's been hypothesized that will we cause managers to sort of be in trouble, and we don't hope to cause more problems for an institution, but again, hope to sort of support the managers and support the organization to create a culture that helps support the clinicians as well. So we know that there will be like, what do you do with this data? If it's chronically coming up, what sort of remediation is there? So we have discussed that and understand that.
All right. I'm sorry to cut. I know this is, we all know AI is a total hot topic right now. And, as you think about what you want to ask to our panelists and our judges and the QA, thinking about, we've heard about ROI, so return on investment. Thought about there's some elements of AI in there, thinking about the true positive, the false negative, all of those things that mix together to get the right type of level of outcome. And machine learning algorithms, thinking about training, testing, and then fine tuning, all those hot topic AI type of terminology. We also covered grants a lot and fundraising a lot through all three of our different panelists. And then also the first term of first mover advantage coming up during this Q&A session too, and how it is to kind of enter into an innovative space, being one of the first people or the first entities looking to solve a problem there. What I thought was really, I sorry, and I'm obsessed with AI. If anyone knows me, AI is my AI and data. But the pairing of the outcome and the action and the suggested action on the manager, I really thought that was thoughtful. I have to be an independent party. I got to pull this back now. But now that, our finalists have hopefully stopped sweating because they have been grilled by our judges, we'd like to first talk a little bit about an avenue for our community out there. And that is the APTA Innovation Community. And so you've had this taste of what happens when you have a prototype and you have a great idea. But we also want you to understand that there's amazing opportunities for innovation in our practice and ways of being able to collaborate together through the APTA Innovation Community. So you can please, if you are an APTA member, there's a lot of, please consider joining the APTA to find your people. But start a conversation or join a thought thread on the APTA Innovation Community. In order to get there, what you'll do is you go to the APTA site, go to APTA and you, select APTA Community, and you'll see the ongoing discussions about practice. We hope that you can contribute to changes being considered in your APTA Academy and interest groups. This is also a great way to find to start your own innovative journey and to see what's out there, to find people that can join you. Let's bring it all back to what Ben said in the beginning, and finding people that can come together and help you through some of the challenges that do come up when you have a great idea and you want to take that so that it can solve other practitioners, other providers' problems and challenges, and our patients' problems and challenges. So we mentioned that there would be nowhere without you all in the audience and our community attendees. So I will now pass the mic to Sujay Galen to host our audience Q&A session. And we have some really great questions. So as you're thinking, please type in some questions into the Q&A, anything and everything. It could be related to our finalists, or maybe you're thinking about your own creative solution to a problem that you have and you want to get some ideas on how to get started or how to overcome a hurdle. All of it is open. Take it away, CJ.
Thank you, CJ. And first of all, I would like to thank our audience for making this a very lively Q&A, because I have a lot of questions here. And also, I would like to thank our three finalists, because your presentation has inspired our audience to ask these questions. And so when CJ said stop sweating, I would say maybe sweating starts again for a wee bit of time as I ask this question. So let's start with our first finalist, Gravitrex. So Kira, these questions are for you, and I'll ask them in the order they were sent to me. So first question, are there any specific training needed for providers, and how complicated is the training if it's needed?
That's a great question, and we're specifically designing Gravitrex to be a tool that's really easy to use. So we are designing it to have a very low level of training required. I mean, currently on our prototype, there are really 3 manual steps that you take in order to set it up. And so right now, as we're doing feedback, as we're doing demos, as we've just finished the beta prototype and we're doing demos, we're getting feedback on what type of training level would be required for a physical therapist. But the intention is to have it be something which is very quickly, when I say very quickly, like an hour of training in order to be able to operate the device.
Thank you. And that takes me to the next question, which is, you said you had some interaction with clinicians. So what kind of response have you received from clinicians who have either used or seen the device? Would you be able to share that with us?
Yeah, I mean, the response has been fantastic. People are excited that there is something that is, again, that's really something that's easy to use, and clinicians have been excited, as well as administrators at facilities who see this as a way to really, people have said things like, I could turn my hallway, I don't have much space in the rehab gym, but I can turn my hallway into extra clinic space, and this is really helpful. And I have had other people, we're still just working with the interface with the device is a harness that's attached to these 2 cables that provides the lifting force. But from one of our first demos, I heard this harness is really comfortable, and I never say that. And so those are things that are really encouraging for us. We've also had clinicians ask a lot of questions and talk about a lot of features, and we're assessing based on their feedback what elements will be in the final product.
Fantastic. And I'm glad you brought up this idea about like turning facilities to accommodate your device. So to that point, do you have any thoughts on how do we accommodate in tight spaces? I mean, a lot of clinics are really tight in space. And more importantly, if a clinic or a facility would like to use your device, what would be the cost, either to buy or to rent it? Do you have any sort of recommendations on this?
Right. So we expect for this device to be competitive with overground bodyweight support devices like the LightGait. But we expect it to deliver a lot of value in terms of being easy and fast to use for the clinicians, to be able to turn extra space into clinic space, and to be a great experience for the patients in terms of comfortable and easy to use. So we expect for it to deliver high ROI. For the final price will depend on final configurations after we go through clinical validation and identify the final product design. And we expect for a home use version to be at a much more consumer-friendly price point.
Fantastic. And a final question, do you see any limitation or contraindication for using this device?
We expect that a contraindication would be complete spinal cord injury. So, for example, a person would have to be able to at least put a little bit of weight in order to use the product, is what we expect.
Thank you very much. At this point, I will probably transition to the next finalist, but these are great answers. Thank you again, Kira, for that.
Thank you. Thanks to the audience for their questions.
Absolutely. And so my next set of questions are for Justin from Exoglide. So Justin, have you documented any balance testing pre and post use of your Exoglide device with the basically see the proprioceptive benefits that you talked about in your presentation?
So I have some videos from people outside of the clinic. I technically cannot use my device in the clinic because of just some controversy with branding and stuff like that. I don't actually promote it in the clinic. It's just if somebody's interested in some word of mouth, they find my website and things like that.
So there's not been any studies or anything like that done to document or to study it at this point.
No, just anecdotal evidence from the clinic.
Thank you. One of our audience felt that the device looked really awesome, so I think a positive compliment there. But they also want to know, can this dorsiflexion range be adjusted by tightening, if you like, the strap?
Yes, you can increase the tension to help improve some of the dorsiflexion action.
Wonderful. And what would be the weight of this device that you're applying on top of the shoe?
So the device weighs about 3 ounces, 3 to 4 ounces. So it's not very heavy at all. But I have put it on patients. They're like, man, you're putting a weight on my ankle? I'm like, no, here, I'll let you hold it. And they're surprised. It's just the pressure down from the tension from the resistance band.
Because I think that's a concern that comes up. If it's heavier, for example, does it place more demand on, for example, the affected limb? Or, for example, does it increase the edema or any other presentation the individual may have? So have you seen any of that reported by your patients or users, I should say, at this point?
No, there's very little. It's either neutral to positive feedback pretty much, unless somebody has hypersensitivity on the top of the foot. But there have also been cases where they wear it for just a little bit and then that hypersensitivity goes away. I wouldn't use it with somebody with severe peripheral vascular disease or somebody who has a fracture.
Thank you. And in your Q&A with the judges, I think you alluded to that when you try to use it yourself, you didn't wear it for a long period of time because of the stress it places. So do you think any long-term use can actually increase the stiffness of the joints or even the pain the individual might be experiencing?
I've had some people who wear it, they've worn it for years now, at least 2 years, and they haven't had any detrimental effects. I still keep up with them occasionally.
Oh, wonderful. Thank you, Justin, and for answering those questions. So at this point, I'll transition to our last and final finalist, to John. And John, the question I have here from our audience is, what is the downside of the platform or the system that you've created? For example, what are the ethical issues that you probably identify with the system? I think we had some of that with the Q&A with the judges, but if you can expand on that, that'd be great.
Yeah, no, great question. Some of the technical issues are just the amount of training and time it takes to get the model to be accurate, just because you're feeding in a lot of data and having to tweak the variables over time. Initially, it just won't be very accurate. And it does take a good amount of compute space. So navigating where it lives and how to transfer the data securely are sort of our big technical challenges.
Going on that ethical theme, because there's obviously data that the boss or the owner or provider can see. So can they use the system to terminate an employee or a clinician based on what your platform is providing as data to the owner, for example?
The short answer is no, but that would be after we would only integrate our software in a company if we'd gone through their approval process, through their legal team, through their HR team. So we would make sure that people understand the implications of using it, and there's approvals from human resources and legal team, and we would make any modifications based on the company's requirements. But yeah, data should not be used to terminate an employee just solely on the metrics that we would be reporting.
And again, because it's about employees and the people in the clinic, there's some other concerns around, for example, confidentiality being broken and anonymity not being established and things like that. And can an employee, for example, if they feel very uncomfortable, can they have the option to opt out of the program?
Yeah, I think that sounds appropriate if they want to opt out. And we would also just ensure our clinics that the process we use would be the highest level of security. We know that HIPAA sort of interfacing with EHR, we'd have to abide by that and have secure data transmission and storage. But yes, certainly clinicians could opt out.
Fantastic. And in your platform, as you're tracking clinicians with their different tasks, is there a way they're actually tracking now with all the new AI coming in with SERP nodes and stuff like that? Can your platform actually track the use of AI or other technology within your sort of program, and how that contributes to burnout, I guess?
Sorry, maybe I'm not. Can you restate it again? Is it like with the new technology, like AI for documentation and AI for other things? Can our technology sort of integrate new technology? Is that what you're asking?
No, can it track the use of that and see if that has potentially any impact on burnout?
Yeah, that'd be great. So like if a clinic is using ambient documentation and it can auto generate your note without having to manually type it, yes, that could change someone's documentation metrics and change some of the metadata that would go into our model. And yes, that would totally pick up on those effects.
Fantastic. And finally, in your sort of ICO program, I think you called it, who did you interview as potential customers for this platform?
Yeah, we interviewed over 50 folks, and it was a pretty wide range, ranging from chief of HR positions, chief hospital executives, safety folks at hospitals and clinics, managers, physical therapists, and we had a couple CTO folks that we got to talk to as well. We tried to get a wide range across sort of not just the customer base, but also sort of the software buying process and what's the system for integrating into a clinic.
Right. Thank you very much, John. And those were all the questions for the finalists. There was a question about global IP, and I think this is relevant to the finalists, but also to the judges and the panelists. What kind of, can you all provide your sort of expertise or information on global IP and how that applies to any innovations that are being developed? Does anybody have any thoughts on global intellectual?
I'm not an IP attorney, but I can take a shot at it. I guess
Sure,
the IP process is typically people here would be applying in the U.S. first. So you'll file your application, and it's a multi-step process, right? Where typically people file a provisional application, and they file a full application, and then they get a response from the patent office, and you respond to their objections and adjust your patent. So it is a long process with multiple steps along the way. And one of the steps is deciding then where you would like your patent to be enforced. And so what a patent does is it really prevents someone else from doing the thing that you have patented. So it doesn't allow you to do something. It prevents someone else from doing the same thing that you're doing. And so you can choose other countries where you want to prevent people from being able to do that. And it gets quite expensive because as you choose those countries, they all have filing fees, and then you also have language translation fees to get your patent into the new language for it to be in that country. And there are groups of countries that are in the same consortium. So there are some ways where the costs are brought down because of various treaties between countries. So I guess the short version is it's a long process. You get to pick the countries as you go along in your process. And the more countries you pick, you end up paying, a lot more money. It can take, a US patent might be, $30,000, $50,000 by the time you're done with it, something depending on the complexity. And then you're in the hundreds of thousands of dollars if you try to do something across all the countries. So you have to balance, am I really going to produce this in that country? And if I did, and someone cheated on the patent and made a product, would I really try to go stop them and sue them? And is it worth the money to go and try to have protection in those countries, as well as the laws in those countries that also affect your ability to protect your invention? So talk to an IP attorney. It's complicated and expensive.
Yeah, if I could underscore what you just said there, Paul, at the end, our IP attorneys have actually recommended that we just use trade secrets and not try to go after other forms of IP protection. There's two things to consider, aside from the cost, is will you pursue them, which also becomes very expensive. And with software, you have to expose a lot of your code. And the only thing people have to do is change a little bit of the code, and they have now a new product. So with my product being software based, we've chosen to keep everything as a trade secret instead of pursuing any other sorts of intellectual property protection. And so I think it's just one of those things that. And then, the other second thing is investors love protected IP. And so if you want to go for funding from like angels and VCs to build your product, then they're gonna expect to see that, but they also may pay for it. So because they want to protect their dollar and their investments, but then they'll also be around hopefully to pursue the people who try to steal your intellectual property. So it's kind of a balance early on as to, when and how to do that. I think mechanical things are a little bit harder because you can see an image of it, and you may want to protect that through your intellectual property protection mechanisms. But with software, trade secrets can sometimes be, think of it like the ingredients for Coca-Cola, right? Trade secret.
Thank you, Cheryl, and thank you, Paul. And if I were to summarize, it depends on the innovation, and at the same time, how much of cost are we willing to put on it to just get that global IP. So I really appreciate both of your answers. Just to keep on time, I think we had one last question come in for John for the Provider Pulse. And the question goes along the lines of, if your algorithm is not aware of, for say, example, the provider's learning disability or any other medical issues that they may have, how do we overcome that? Or how does it address? Because then if that is contributing to the burnout and we don't have any information on that, how do you take into account that?
Yeah, great point. So I guess they're asking if the provider has certain accommodations or certain requests that are special. That we are building out a space for manager input. So we like that the managers know their people the best. We don't want to take the people out of the decision making, so not machines are taking over. But so we are building an idea that the manager can have input into, I know Tim over here versus Jerry over there, and they can sort of add a comment, which we could take into consideration for the data.
Oh, so the manager has the ability to go in and actually feed some information to the AI, and that'll go to the decision making process. Wonderful. Thank you, John. And I'm looking at the clock here. We got maybe a couple more minutes, I guess. 3:28. I was supposed to hand over back to CJ. So any other final burning questions from our audience this afternoon? Going once? Oh, sorry. Go ahead. Somebody had a question. All right. Hearing none. Over to you, CJ.
Last chance. Any other burning curiosity from the audience, from the judges? Excellent. All right. So before we go, this is concluding our webinar. We want to extend a big thank you to our judges for these engaging Q&As, as well as the audience for asking these questions. And thank you for sweating it out our finalist contestants. These events hosted by Ally are designed to inspire the PT's profession's transformation beyond clinical excellence to improve the human experience. And I think we've seen today that there's this desire to do that. And we've seen 3 fantastic examples of how we're doing that right now. Our webinar today was recorded and will be posted on the Academy's website in the near future. The judges will be sharing their scores over the next few weeks, and the winner of the Shark Tank will be announced on both social media and the Academy newsletter in the beginning of December. Our winner will be featured during the Ally Business Meeting being held on Friday the 13th, February 13th at the APTA CSM Conference in Anaheim, California. I'm asking everyone, will you be there? I will be there. Love to meet with everyone. Not only that, but they will also, our finalists, our winner will be featured at the Ally exhibit booth during CSM, and will be joining us for Technopalooza event happening at CSM on Friday as well. So please don't be deterred by Friday the 13th during CSM. Come out, come have some come party. Come see some really cool tech, come play with some really cool tech. And if you're interested in attending the Ally meeting, Ally Fest, or the Technopalooza event, or all 3, please check it out on csm.apta.org. As we sign off here, also please consider joining the Academy of Leadership Innovation at aptaali.org. I as one member of the ally. I have found my people as an innovative. I work in the industry right now. I still consider myself a PT, but this is where I feel home in the Academy of Leadership Innovation. So please join all of us in supporting an innovative community in physical therapy practice. And with my ability to speak running out, I'm just going to say thank you to everyone who has joined us today. Thank you to those who are watching this recording. As always, you always have an opportunity to ask questions through the innovation community, any of the APTA communities, and any of the panelists or judges here too. I'm sure I'll put them out there as people that can be reached out to with any of your questions. I thank you all and have a wonderful, wonderful day. And then I just hold on one more note. All business meetings are open to CSM participants. You do not have to be an ally member. So I just want to put that out there. Come see what it's like. And then any other academy as well. You can go see what that's like too. Thank you again, y'all.
Thank you
so much.
Are we
Great
staying
job,
here?
Thank
Or
you.
leaving?
Yeah. Well, I just wanted to say thank you to everybody. This really, really went so well. And especially with pulling things together a little bit at the last minute for some of the pieces. And, especially Victoria for jumping in. She just, a week ago, that was great. And for everybody, great questions, great interaction. And with, the time changes throughout the event, it really, really went so smoothly. So excellent. I'm so excited and grateful for all of you. Thank you.
CJ, Sujay, you guys were amazing.
Thank you.
Yes.
And Rebecca,
absolutely.
the pre stuff was awesome. You did a great job. Appreciate all those
Thank
emails.
you all for your patience. I know I'm like, they're definitely getting sick of me by now, but
None of this would be possible without Rebecca. I will say that.
True.
Well, I'm looking forward to helping maybe, mentor somebody into taking it over in the future because it's fun, but I can't have all the fun. So more to come. All right. Well, I'll be reaching out to all of you with just some follow-up stuff. And hey, thanks. Have a great rest of your day. And I look forward to seeing you all very soon. Happy holidays too.
Bye.
Bye. Thank you.